Hey guys, today we're talking about veneers and all the questions we get asked about dental veneers. So same as last time, Angela's gonna ask me a couple of questions related to dental veneers and we're gonna answer them for you.
Alright, who's a suitable candidate for veneers?
So best thing to do would be to go talk to a dentist because we need to check so many things inside the mouth. It's not something that I could give you a general idea, but I'll give you some points. For example, if you have gum disease, you wouldn't be suitable until the gum disease is fixed. So that's why you have to go see a dentist. You have to have healthy teeth to be able to put the veneers on them. Remember, veneers go on top of your teeth. So if your teeth underneath are not healthy, if they have cavities, if they have badly done fillings or fillings which basically need to be replaced, then doing veneers on top of them would not be a good idea. Also at the dentist we will check your bite. People who grind their teeth when they sleep, for example, not a good idea to have veneers done unless they are going to 100% wear a sleeping guard every time they sleep. So stuff like that have to be checked with the dentist.
Okay, and sometimes when people are doing veneers, I see like these little baby teeth that have been filed down, and that's pretty scary. Does it damage our own teeth?
Well, short answer would be yes, because remember that for any sort of veneers, the dentist need to slightly shave the teeth back. Although what you describe now as baby teeth, they are mainly done when a crown is being done. Crown is different from veneers, and I explain for you later on. For doing a crown, we need to remove more tooth structure because the material going there needs to have a specific diameter, a specific bulk of material have to be present, otherwise it will break. But on the other hand, remember that even with veneers, you are slightly damaging the tooth on purpose. But that's the same with even doing orthodontic treatment. When you do Invisalign, the dentist has to shave in between your teeth. So do not worry if it wasn't safe for your teeth, we wouldn't do it for sure. But yes, basically doing the veneers, you are losing about 0.6 millimeters of your tooth structure at the front. If the dentist do not remove anything, do not shave your teeth back at all, you're gonna have very bulky veneers there. There is another type of veneers called no prep veneers that I get asked about a lot. They are not suitable for everybody, and basically if we do not prepare your teeth, the veneers will stick out of your mouth. They look bulky and they're not going to be nice.
Oh, so beaver teeth.
Basically, yeah. So for no prep veneers, you have to be very much suitable. For example, we do it for people who have a lot of room for the veneer to go on top of the tooth, or they have already very badly broken down teeth. So as I said before, you have to check with the dentist, but the short answer is yes, you do lose a bit of the tooth, but it does get replaced by a ceramic material or a composite material. You have to bear in mind that once you commit to having veneers done, that's it. For life, you have to be committed, as in if the veneer ever comes off, even in 30 years time, that amount of tooth that you have lost by shaving it down at the dentist is never growing back. So you have to put something else back in there.
No, it's better than beaver teeth, so that's okay.
That is true.
And how many appointments do I need to get this done?
Depending on how many you are getting. So I would say minimum of 2, not considering the consultation. On the first appointment, you come in and you basically get numb around the area. We inject so you don't feel anything. We prep the tooth. We take some molds, some physical or digital impressions of your teeth, send them to the lab, and you will leave the first appointment by having temporary veneers on your teeth. So you go home not with shaved teeth, you still have veneers on them, they're just temporarily placed until you come back next time and get them properly placed on. On the second appointment when you come in, we will remove the temporary veneers and we will place the real ones on. You can look in the mirror, you can make sure you're happy, and once you are, then we will cement them or glue them on your teeth permanently. They will stay on for a very, very long time then. As you can see here, this patient of mine came to me with very much stained teeth due to a genetic reason and also very large fillings that needed to be replaced. So we took all the fillings out because they had to be replaced anyways, and we prepared his teeth to have crowns for cosmetic reasons, for a smile makeover. As you can see here, the teeth are already prepared and we are placing the crowns on one by one. Now we had to remove all the fillings so the teeth look small underneath, but it's better to have healthy teeth rather than lots of fillings that need to be replaced due to new decays. So we are putting on the crowns one by one for the patient to be able to have a look in the mirror and see if they're happy. And as you can see here, the result was lovely. The smile is white, the teeth are protected by crowns and no more cavities or decays. Veneers are usually much thinner than a crown. They are usually 0.5 millimeters up to 1 millimeter thick.
And the temporary veneers, are they obviously look the same? You're not going to look weird during that week that you're waiting for the actual veneers to be made? Like, are they the same in terms of strength, or are we going to get a veneer that pops off?
No, so basically they are not strong. They're not as strong as a real veneer. Otherwise, why would you change them, right? And they don't look as good, but they look okay. You can, I mean, it's only, let's say, a week or two or maximum of 3, and you're getting something for, you know, hopefully decades to stay on your teeth. So they are not as strong. If they're done properly, they will last for the whole 2-3 weeks that you're waiting for your proper veneers to be made by the lab. But you have to be careful. You shouldn't bite on things too strongly because they do have the tendency to come out easier than a real veneer.
And what's the difference between composite and porcelain veneers?
Alright, so yeah, very important question, and I get asked that a lot. The difference mainly is in the material. Composite is basically white filling. It's what you get when you go to the dentist and you have a hole in your tooth and you need a filling done. So composite is made of polymer, or in layman's term, let's say plastic. It does look good when it's done properly, if we polish the teeth properly. So the better the dentist polishes your your composite veneers, you're gonna get better results, you're gonna get shinier veneers and they look nicer. But the difference mainly is the strength of the material. Composite can easily chip. Porcelain is much more durable. Composite color, although at the beginning you can pick whatever color you want, eventually it can change color, so it does get darkened by time, and that is just in the nature of the material. There's nothing we can do to make it not go dark. At the end of the day, it is a more porous material, so when you have coffee, tea, or whatever food you have, it does catch the stain. Now, one thing you can do, you can keep going back to your dentist once a year or so and get them polished properly, and that way at least you'll have a shinier veneer for a longer time.
And how long do they last? Like, how long does a porcelain veneer last? How long does a composite veneer last?
With a composite veneer, I couldn't give you a timeline. I mean, if it's done properly, it still might chip every now and then, so we give our patients some warranty up to a certain amount of time, but you have to expect it to chip every now and then. There is a very annoying either ambulance or fire truck going around. Yeah, let's ignore that. So with what's the other one? With porcelain veneer, we give you a longer warranty just in case. People usually don't have to use the warranty, but the average life is 15 to 20 years. Now, if you're lucky, if you have good gum, if you keep going back to your dentist, getting a cleaning done, you know, floss your teeth, brush your teeth properly, you have to hopefully get decades out of them. But do not think because they are porcelain, you don't need to take care of them anymore. Anything related to your tooth, if you get a cavity, you know, from another side of your tooth, if you get gum disease, you're gonna lose your veneers. You have to be very careful. You have to go to the dentist regularly and have very good oral hygiene.
And what about like the overall process? So what happens in terms of making a veneer? Like, how is it all done? right from the beginning to the end of you getting it from the lab or making it in the clinic?
So we're going to show you some videos of how it goes on basically every time, but most important thing is the first appointment you come in only for the consult, and you have to have that. You can just come in and have a veneer done because you want to make sure what you're in for. We assess your gum, oral hygiene, dental structure, we take some x-rays, and we decide what's the best option for you, how many you need, what color you need, everything. The second appointment is basically the main appointment. You come in to get your veneers done. Now, if it's a composite veneer, it's usually done on the same appointment. So you come in for a longer appointment, you get them done, you leave with your veneers on the teeth. As I said, you just have to understand and agree that they don't last as long as porcelain. They might not look as natural, although they look very close to natural teeth, and they do change color. That's not something anybody can basically avoid. With porcelain, on the first appointment, as mentioned before, you get numb, you get your teeth prepped, so slightly shaved down, you get impressions or molds taken, and they will be sent to the lab, and you will leave that appointment with temporary veneers on. The second appointment, when you come in, your veneers are ready, they will be placed on, you look in the mirror, if you're 100% happy, they will be glued on your teeth permanently. The one thing I have to mention is, if you're not getting all of your all the teeth that show in your smile veneered, then you have to have teeth whitening done if you want to have your veneers whiter, because usually the reason people go for veneers is either to slightly straighten their teeth, or it's to have whiter teeth, or both. So many patients come to me and say, I want to have my teeth aligned, and I want also to have them whiter with veneers. That way, if you are getting, let's say, in my smile, you can see top and bottom teeth. If you're only getting your veneers done on the top, first you have to have teeth whitening done, so the dentist can match the color of your bottom teeth that were whitened with the color of your top teeth that are having veneers done. You will not have the same problem if you're doing top and bottom veneers, but not everyone will be suitable to do so, and not everybody is advised to have top and bottom veneers, only in very specific cases.
And what about if I've only got a couple of veneers done, and then later on, say like a couple of years later, I want to get whitening done? Does the actual whitening treatment whiten the actual veneer?
No, so that's why if you're gonna get any sort of permanent restoration on your front teeth, even if it's a filling, you need to first have your whitening done, or forget about it, never have whitenings done. Let's say you have already 4 veneers on your 4 front teeth and you want to get teeth whitening done. We can never predict how white your teeth will get after the whitening. So what if they are whiter than your veneers or not as white? That's why you have to, if you're thinking about having teeth whitening done, get them done before you do any permanent restoration on your teeth, whether it's a composite veneer, it's a porcelain veneer, or it's just simple filling.
Okay, I think we're very veneer educated now. So thanks, Dr. M, for answering all our questions.
No problem. See you next.